Hello everyone, my name is Francesca Caraballo and I will be doing a presentation on infant mortality. Despite the medical advancements and access to healthcare in the United States, infant mortality is still a concerning health issue in this country. According to the Center for Disease Control and Prevention, infant mortality is defined as the death of an infant before his or her first birthday. The National Scorecard on U.S. Health System Performance for 2011 details how for every 1,000 live births, there were 6.8 infant deaths. In 2017, that number was 5.8 infant deaths for every 1,000 live births. Now, 5.8 and 6.8 might not sound like a lot of infant deaths, but if we look at the full quantity, in 2017, there were a total of 22,000 infant deaths in the United States. The majority of these infants passed away due to prematurity, low birth weights, birth defects, sudden infant death syndrome, also known as SIDS, injuries like suffocation, burns, or falls, and maternal health issues such as hypertension, which can lead to preeclampsia or placental abruption. In questioning whether the infant mortality rate has improved or deteriorated, the answer is a complex yes. Why do I say this? Well, as I stated before, in 2011, the rate of infant deaths was 6.8. In 2014, the rate was 6.4. And in 2017, we see that it decreases to 5.8 for every 1,000 live births. When you look at the data trend provided by the CDC and the Commonwealth National Scorecard on the U.S. health system performance, we see that over the last decade, the rate of infant mortality has been very slowly but steadily decreasing. However, there is a disparity between the causes of death in rural areas in comparison to urban areas. For example, in rural areas, there are higher rates of infant mortality due to congenital birth defects, SIDS, and unintentional injuries than in urban areas. In urban areas, there are higher rates of infant mortality due to maternal health issues or low birth weight. The CDC for Disease Control and Prevention collaborates with various associations and programs to study what causes infant deaths and how to help prevent them. One of the organizations is the March for Dimes, and together with the CDC, they provide funding for perinatal quality collaboratives, also known as PQCs. The purpose of PQCs is to improve the quality of care for women during their pregnancy, reduce the rate of premature births, and in the case that a child is born premature, improve the care provided for that premature infant and the mother postpartum. PQCs are a statewide program, and currently the CDC is providing funding for multiple states, including New York. The CDC's Division of Reproductive Health has a sudden unexpected infant deaths case registry. This registry collects data in 16 states and 2 jurisdictions in regards to the circumstances in which the infant passed away. The goal of this organization is to reduce the incidence of SIDS, suffocations, or strangulations in bed. The Pregnancy Risk Assessment Monitoring System collects data on the mother's experiences prior, during, and after her pregnancy, with the goal being to identify which populations in each state are at higher risk for health issues. The CDC's National Center for Injury Prevention and Control collects data on child abuse, child neglect, as well as unintentional childhood injuries with the goal of providing both healthcare professionals and parents with the resources to prevent these injuries. The CDC's National Center on Birth Defects and Developmental Disabilities works to study causes of birth defects, ways to prevent them, and ways to improve the quality of lives for children who are currently living with birth defects. This is significant because birth defects are the primary cause of infant mortality in this country. Equally developed countries such as Japan, Australia, and Finland have lower rates on infant mortality than the United States. So, what is the United States doing wrong? One of the issues in the United States is that infant mortality has been strongly tied to poverty, and this correlates to higher incidences of SIDS. in part because of the economic need to co-sleep and because of a decrease in access to neonatal health care, particularly for infants born premature and needing more advanced technological health care services. In comparison to many of its European peers, the United States does not offer universal access to quality prenatal health care. This is significant because 50% of the pregnancies in this country are categorized as unplanned, meaning that for many women, they might go their entire first trimester without knowing that they are pregnant or having prenatal health care. This might also be a contributing factor to preterm deliveries. Another factor is that in the United States, there is no mandatory paid maternity leave, meaning that it is up to the employer's discretion to provide payment during the standard 12-week maternity leave. In comparison, countries like the United Kingdom and Bulgaria offer almost a full year of partial to fully paid maternity leave. It is thought that maternity leave has a statistical relationship with infant mortality because of the high rates for SIDS in daycares and other childcare settings. Furthermore, in countries with longer maternity leaves, the children get sick less during their first year of life. I can actually relate to this on a personal level because when my daughter was born, at 36 weeks, I went back to work after 5 weeks, despite having an emergency C-section. And yes, I did go back due to the economic necessity. And after a week and a half of me working, I actually had to take her to the emergency room for RSV. Another area in which the United States can improve upon is providing more access to nursing home care visits for infants and mothers postpartum. In many European countries, there are social programs in place that offer free home care visits, and these visits help to reinforce safe behavior and they assess unsafe risk factors, such as unsafe sleep practices, signs of jaundice or dehydration. This is particularly important to establish here in the United States because in this country, more than 20% of parents do not place their infants to sleep on their backs, which, as we know, increases the risk for SIDS. The National Scorecard on U.S. Health System Performance for 2011 assesses in what areas the United States healthcare system excels and falls behind in comparison to other countries. The 5 areas are access, quality, equity, efficiency, and healthy lives. In reference to the healthy lives category, the goal is to assess factors that increase the risk of premature death and overall unhealthy risk behaviors such as smoking or obesity. Within the healthy lives category, infant mortality is assessed because it is often a good indicator of the general health of a population. In order to assist in decreasing the rate of infant mortality, there needs to be local and national policies put into place. I would initiate the policy change in relation to access to affordable prenatal and neonatal health care. Due to the high rate of infant mortality in the United States, prenatal and child health care should be provided to every patient despite of income. In rural areas, mothers experiencing high-risk pregnancies should be referred to the appropriate neighboring facility. Rural areas should also be assessed to identify which cities in particular are lacking adequate prenatal and neonatal health care services. In both rural and urban areas, the Back to Sleep campaign should be reinforced, and parents should be educated with the fact that back to sleep is not just a suggestion, but an actual medical recommendation. This updated Back to Sleep campaign will start during the mother's prenatal visits, and prior to discharge from the hospitals, parents should actually confirm if they are able to comply with the Back to Sleep practice for their infant, or if they have an economic need for a bassinet or a reduced price cribs. And there are organizations such as Cribs for Kids that assist with providing parents with low-cost cribs, and their information would be made available at every hospital with neonatal or labor and delivery services. This presentation will be presented to the statewide constituents. I am asking that Congress allows for an increase in funding for healthcare provided for women and children. Despite everyone agreeing that a decrease in the rate of infant mortality is a desirable goal, we will be unable to achieve it without the financial support of the government. Therefore, I also ask that the Congressional Committee provide funding for the Back to Sleep campaign in order to assist in decreasing the risk for SIDS. I ask that the Congress provides funding to increase the access to quality health care in rural areas and to aid in decreasing the health care disparities between affluent and lower status socioeconomic communities. Thank you.